مساء الخير جميعا, and hello to our wonderful healthcare workers. Tonight we are here to talk to you about some relaxation and mindfulness techniques. From our topic, I think you were able to grasp a little bit of what we're going to discuss tonight. Take a deep breath and slow down. Talking to you, Senior Clinical Psychologist Mahal Muharib, and a member of DIME Consultant Advisory Committee. We will start with Dr. Saud Al-Omar. He will talk to us about how to apply for DIME and give us a little information about DIME services. Dr. Saud Al-Omar is the chairman of DIME Consultant Advisory Committee. We would like to welcome him, and we will start with him tonight. Thank you so much.
Assalamu alaikum wa rahmatullah. Good evening, everyone. Thank you, Maha. Actually, just I would like to talk maybe for like 5 to 10 minutes, or just to explain to you how to access DIME services. As you know, Saudi Commission has launched DIME for all healthcare providers. Initially it started for the trainees, but now it is open for everyone. Everyone can access. It is psychological support, online support. So if anyone has any kind of psychological issues, anxiety, sleep issues related to COVID-19 or depressive symptoms, he can apply for this service. Once you apply, just I would like to share with you the website, but once you apply for the service, you will receive SMS and email stating that your request has been accepted. Then your request will be transferred to our counselors. We have like almost around 40 or 40 plus counselors among psychologists and psychiatrists. After which, if it is urgent, top urgent, you will be seen, or they will talk to you at the same day, usually within 2 to 3 hours. If it is not urgent, maximum 72 hours, but so far we are responding within like 24 hours. Then you will receive this message. Appointment you will sit with, or the counselor will set appointment with you. Then we'll talk to you to help you to overcome this critical time. So. I hope my screen is, you can see my screen now.
Yes, Dr. Saud, it's clear.
Oh, okay, great. So you can, first of all, you have to go to Saudi Commission website. Then you can go to e-services. From the e-services, you can go to practitioner services. Then scroll down, or it's not down actually, it is in the first line. So DIME for practitioners. Click on that. Once you click, you'll see like 4 icons. First one is what is DIME, which is like definition of DIME. It is like giving you some introduction about our services. Then the second one, which is we are here for you, which is the application or the one where you submit your request. This is evaluate yourself. It is like some infographics, or it is a flow chart about some common psychiatric disorder like depression, anxiety. Just you can also try this one. And this is more about your mental health, which is it's like some infograph and some brochures, pamphlets for education. So the most important thing here that we are going to talk about is we are here for you. So click on this link. It will take you directly to the application site, then you can select you are practitioner or trainee. Trainee, we mean any resident in the training centers, whatever, whether it is diploma or residency program or fellowship, they are considered as a trainee. Otherwise, anyone who is not a trainee is a practitioner. So you can just select a practitioner, then it will give you or ask you to fill up some information. Those information which is requested just to make sure that you are healthcare provider. Your personal information will not be shared with anyone. It is just for just to make sure that you are a practitioner. It will not be shared with anyone. Even your information, which will be sent to your counselor or your psychologist or psychiatrist, he will not see all this information. You can choose any nickname. It's not necessary to write your real name, even your number. If you would like, you can add any other number other than the one which is registered in your Mumaris account. The service, it is like a session. It is like counseling session. It depends. Sometimes it takes 30 minutes, 45 minutes, sometimes 1 hour. It is free. And as we said, it is highly confidential. After you log in, there are some questions. It is like screening question. After you answer those questions, there is like text box. If you want, you can describe whatever you have. Otherwise, you can write psychological support. Then we will contact you soon. I hope this is just very quick explanation how to access Da'am services. I'll be very happy to answer your question by the end of this webinar regarding the access or the service itself. Thank you very much.
Thank you so much, Dr. Saud Al-Omar. Tonight we have two wonderful speakers that I'm sure you'll benefit greatly from. We have Dr. Noor Habib, Senior Clinical Psychologist from King Faisal Specialist Hospital and Research Center in Jeddah. And we have Ms. Yasmin Break, Senior Counselor at the Renewal and Reward Center in the Eastern region. Tonight you'll be able to learn the difference between mindfulness and relaxation. You'll be able to apply those two whenever you need to slow down and get a deep breath. We will start with Dr. Noor Habib. Welcome, Dr. Noor, starting with mindfulness.
Thank you very much. Thank you very much for inviting me. Thank you very much for having me today. And thank you for everyone who's attending with us today for taking the time to look after yourself during this quite unusual time. Let me just share my presentation with you. Okay, so when I was asked to choose a topic for today's session, I felt that mindfulness was very appropriate actually to talk about. Mindfulness has very good evidence in treating different mental health issues. I do use it in my practice, and I do see the benefit with my patients in clinic. And I do see the benefit of mindfulness with my colleagues when I do such a session. And I do use it personally, so I very much believe in mindfulness. I would like to invite you to slow down and perhaps to try to connect with yourself and check in. And perhaps asking yourself, how are you today? Maybe connecting with your emotions and asking yourself, how am I feeling? And maybe what is going through my mind? Whatever comes up for you is absolutely normal. You know, we are going through quite an unusual time. It is a stressful time if you're a frontliner and you are there working with your patients. And if you're working from home, it doesn't make it easier and it doesn't make it less stressful. So if you feel worried, anxious, perhaps stressed or overwhelmed, or maybe low or sad, or perhaps frustrated, or maybe on the other note, excited, something is coming up for you, or maybe just content and feeling good in yourself. It doesn't matter what emotion you're feeling. Whatever you're feeling is an emotion that is there telling you something about whatever is going through your mind and whatever you are experiencing in your body. Autopilot mode. We function most of the time on an autopilot mode, meaning that we are either in the future, worrying and thinking about all of this uncertainty related to COVID-19, and everything is happening at the present time, or you are there in the past, or I would say we are either in the future or in the past, upset about something happened in the past, any kind of incident or trauma related to COVID, if anyone was infected around you, any of your patients. So we're either in the future or we are in the past. And what we are missing the most is the connection with here and now. Grounding ourselves in the present moment is what we mostly missing. And we actually, I always like to give this example. When you wake up in the morning, and if it's working day and you're still working with your patients, most of us do reflect and say that I wake up in the morning and I find myself at work, or I find myself parking my car, autopilot mode. So we're not connecting actually, and we're not aware of the process and what is happening between waking up, what happens, all the details and all the steps. And when we go out and we start driving, who's around, how is the weather, what colors are around, who am I meeting on my way? We are either there in the future, in next meeting or next patient we're seeing, or we are there in the past thinking about what happened last night or the day before. Okay, so we are mostly missing that connection with here and now. So let's talk a little bit of mindfulness, and that would be very much the focus on my talk today. So mindfulness basically is a type of meditation where individuals take in moment-to-moment experience as they come. So it is about noticing your internal experiences, whatever thoughts or feelings that might come up for you. And at the same time, it's about that quality of being non-judgmental and open to whatever comes up for you. Okay? Sometimes I sit with some people, and when I ask them how they're feeling or if they're talking about specific experiences, not only that I notice sadness if the person is talking about something sad, but also sometimes people feel angry for feeling sad, or some people feel very angry that they're feeling anxious. Okay, so mindfulness actually help you to identify whatever emotions you're feeling, whatever thoughts are linked to those emotions and internal experiences, not only noticing, but also not only noticing and being aware, but also to stay with whatever comes up for you. Okay, so it's the stance of openness and non-judgment. Okay, I will later, perhaps if there is time, I will try to link to some of the underlying mechanisms of mindfulness, because mindfulness is different from relaxation. Okay, while mindfulness is a state of awareness, relaxation more about releasing the intensity of stress and those kind of emotions. Okay, so there are differences between mindfulness and relaxation, and there are different mechanisms underlying mindfulness. So as I referred earlier, there are good evidence supporting mindfulness practice, and I would say growing body of evidence. This is a difficult time, and we do need to look after ourselves. And mindfulness is one of those approaches that can give you some exercises, I would say, that can be helpful for whatever you're going through internally, whatever emotions you are experiencing, because we agreed that whatever comes up for you, it's an emotion that is telling you something. We're not trying to push them away, but we are trying to develop a different relationship with those internal experiences, thoughts, and feelings. So again, research showed or was showing good evidence, the impact on sleep, mental health in general, and anxiety, depression, even with some physical conditions like chronic pain. I do personally use it with chronic pain with some of my patients. So, and it is supported by evidence. And as they say, our capacity to stay calm during time of crisis is quite crucial. One of the Zen masters, who is quite known, was describing the Vietnamese refugee crisis of the 70s and early 19s. And he was saying that when the crowded Vietnamese refugee boats met with storms, okay, if you can visualize that, when the boats met with storms, if everyone panicked, all would be lost, okay? But if everyone or every person on the boat, or maybe even one person on the boat, remained calm and centered, it was enough. It actually showed the way for everyone to survive. There you go. So it's about grounding yourself in the present moment, being aware of whatever is going through your mind, at the same time anchoring yourself or your attention on your breathing, okay, while you're here and now, and you are quite open to whatever emotions come up for you, okay? Perhaps, I don't know if you take a moment just to reflect on your practice. And if you're one of our frontliners and you're working with patients, COVID-19 patients, where this threat system is quite activated, if you think about yourself at time of crisis, how you can ground yourself and how can you ground people around you, whether you are leading your team or you are an effective team member. Okay. If the lecture is more interactive, I would have asked people about what's going through their mind and give me experiences, but we'll take it as it comes. Okay, so if you're willing, I would like to invite you to join a very short breathing exercise, just so you can get sense of mindfulness and how it feels like. Okay, so if you're willing, I would like to invite you to sit comfortably in your chair, whether you're sitting on a chair or a sofa, making sure that you're sitting upright, and perhaps making sure that both feet are touching the floor, allowing yourself to feel grounded at the present moment, and perhaps noticing the connection between your body and the chair, dropping your shoulders, and perhaps closing your eyes or lowering your gaze, whatever feels comfortable for you. Allowing your facial expression to rest. And then when you are ready, step one of the breathing space is to notice and acknowledge what is going on for you right now. Whatever thoughts, feelings, or emotions, or any sensations in the body. Just tuning into these as they are right now. And continue doing this and being open to whatever is coming up for you for a few moments. As best you can, letting go of the tendency that we all have to want things to be different from what they are right now. And see if it's possible to allow things to be just as they are, just as you find them, in your mind and in your body, seeing clearly what's here right now, in your thoughts, feelings, and sensations. Then gently let these fade into the background as we move into the second stage. And then moving to the second stage of the breathing space, focusing your attention on your breath as you breathe in and as you're breathing out. Noticing the raising on the in-breath and the falling on the out-breath. Just focusing on the sensations of the in and out breath. And if your mind starts to wander, that's very normal. Just acknowledge wherever it went and then gently bring it back to the present moment, back to your breathing. Being aware of your breathing and the sensation of the breathing. And then moving on to the third step of the breathing space. And the final step is to expand your attention to the whole body as a whole, again as a whole. As if your whole body is breathing. Becoming aware of all the sensations in your body from the top of your head to the bottom of your feet, out to the surface of the skin, and all the sensations inside your body. Grounding yourself in the present moment, noticing the connection between both feet and the floor. Noticing your posture, your facial expression, and just allow them to be there as you find them, without judging yourself or trying to change anything. It's a sense of being open to what is here right now, a sense of coming home to your body and allowing yourself to be just as you are, moment by moment, breath by breath. And then when you feel ready, I would invite you to open your eyes, to come back to the room, and perhaps stretch out your hands, your arms, and your whole body. I usually ask for feedback here, and I'm aware that it might be difficult for people to tell me how they felt, because how people experience mindfulness is quite different and quite individual. Some people say, "I will just, since it's not very interactive, I can't hear your voices, although, I feel there is an audience there." But some people say that they feel relaxed. And again, I usually say, some people do feel relaxed because of, the breathing itself. But although the mechanism of mindfulness is a little bit different, or the aim of mindfulness is a little bit different, some people say that they were quite aware of whatever was going on for them. Some people say that they felt distracted, and that's very normal. And that's why we call it mindfulness training, right? Because it's about training your brain, okay? So again, if we go back and reflect on some of the cognitive functions underlying mindfulness, okay? So you're focusing on the present moment, okay? Whenever you get distracted, you notice, okay? So you notice whatever is going through your mind, and then cognitive flexibility there, because you bring yourself back to the present moment and you try to sustain your attention on the present moment. Also, there is a lot of emotional regulation mechanisms, because whatever emotions come up for you, you try to notice them and you stay with them. Okay, that's why some people actually find mindfulness really hard and they cannot even practice. And some people say that it takes me a while to be able to just stay there with my emotions and with my breathing. So it is something to practice. I will refer later to some mindfulness apps, which can be helpful for people to go back to and use whenever they would like to practice it more. So let's continue and talk about mindfulness applications in daily clinical practice, and then perhaps to talk about using mindfulness principles in daily life. I'm not sure how we're doing with time, but Maha, please, let me know whenever we run over.
We have 12 minutes, Dr. Noor. Thank
Excellent.
you so much.
Thank you, Maha. Thank you. Okay, so I'll try to be quite brief. I won't go into too much detail. So this is an invitation for some of the points where you can pause during your clinical practice. If you still go and see your patients in the hospital, if you're a frontliner, or if you go to see some patients from time to time, inpatients, or if you're part of the recovery plan in your hospital, you started to see some patients in the clinic. So one point of pausing, it's just a suggestion, when you first arrive at your computer. So in the morning, when you go there, whatever happened in the morning or the day before, it's about centering yourself, grounding yourself in the present moment, okay? And being aware of whatever is going through your mind, taking a deep breath, being aware of your breathing. So being there in the present moment, thinking about what you need to do now. Okay, another point would be as you approach a patient's room. Okay, again, there are some studies supporting how mindfulness can help in the quality of care. It's about being aware of your patient, connecting emotionally with your patient. You are there in the moment. So you're not thinking about next patient, or you're still back in the patient before, but you're rather able to connect emotionally. You are there with your thoughts and with your feelings in the room with your patients. During hand wash, again, it's about feeling the texture, the temperature of the water, how you're doing that, all the precautions around washing hands. It's about, again, there are some of mindfulness principles of connection, awareness, and being open to whatever is going on for you. When you first approach someone, so, human contact, if there is time before an important interaction, again, grounding yourself. I always say that in my clinic, as when I do therapy with my patients, sometimes there are some patients where, there are a lot of kind of very high emotions in the room. So after I see such a patient, I do usually take 2 minutes for myself just to ground myself. I do put both feet on the floor and I ask my nurse for a couple of minutes and I just focus on my breathing and I check with myself, how am I feeling? Check with myself whatever is going through my mind, grounding myself and being aware, and then I'm more ready, I'm more emotionally available for next patient. So whenever you notice that you're feeling tense, okay, and then throughout the day, again, mindfulness is something to be incorporated in daily life or in daily practice. Mindfulness in everyday life, while we're talking today to health professionals, I definitely like to believe that it's only part of who we are, because we are human, right? And life is much bigger than work. So again, mindfulness principles can be applied on daily life. It's about connection with present moment. We don't have enough time. I would have given my usual example of my cup of coffee. I love my cup of coffee, and I do find it an experience in itself every morning. So yeah, again, it's about the intention and awareness, compassion and self-care. I always like to throw it there. A mindfulness exercise, again, we're very aware of some research there supporting behavioral activation, the impact of behavioral activation on mood, specifically depression, but also different mental health issues. So again, it's not only about physical exercise, but also it's about connection with the present moment, being aware of whatever you're doing. Mindful media consumption. This is a very common complaint I hear from different people at the present time, that we hear a lot of stories, we hear a lot of numbers, and there is a lot of uncertainty. So again, it's about being mindful of media consumption. The resource, how much am I following? Do I need to know all numbers? Do I need to do this or that? Just being aware. Daily formal meditation, mindfulness definitely is a recommendation. I do it myself, and I would love to pass it on, just to schedule it in. Like everything else, it's a 3 minutes breathing exercise, or 5 minutes, or whatever you're doing, body scan or imagery or whatever that is. Schedule it in. Have a reminder in your phone, and just, it's me time. Okay, it is very helpful. And again, as we said, it is about training your brain, because if you train your brain, then you can use it when you need it. I like this acronym, and I don't know if I still have time for it, but I'll say it very briefly. When you feel overwhelmed, remember this acronym, okay, of RAIN. So R, it's about recognizing what's going on, okay? Whatever situation, internal experiences, okay? A, allow the experience to be there just as it is. So it's about observing, noticing, observing, being aware, and then being open and not judge. I, investigate with kindness, so explore, so asking yourself, how am I feeling, what's going through my mind, how am I feeling in my body, and so forth. In natural awareness, which comes from not identifying with the experience. So it's not about being diffused with whatever is happening, but rather being able to step back, reflect, and being able to develop that kind of sense of ability to reflect and connect, but also being able to step back and reflect. Okay, it's a skill there. Okay, mindfulness apps. So there are a lot of apps out there. So if you Google, I'm very sure you will find a lot. So those are some of the ones I find helpful, and I do like to pass them on to my colleagues and my patients.
You have 5 minutes, Dr. Noor.
Okay, I'm finishing off. Thank you, Maha. So this should be the last one, okay? And yeah, so they are very helpful. Calm has specific things on sleeping. Some of them just give you a ring, and then you know that it's mindfulness time. And some of them do have recorded scripts where you can actually listen to a voice that is giving you instructions, just like the exercise we did. And with time, what will happen is that you will start to learn. Okay, so you will start to learn how to do mindfulness, and then you can apply it anywhere and wherever you are. You do not really need to listen to the audio or the script, but rather you can just guide yourself through it. Okay, so those are some of the references I have, and thank you so much for listening. I hope you found this helpful. And again, it's a treat. I would leave it with everyone. If you need to look after yourself, please do, because we all need to. So, those exercises can be helpful. Thank you so much. Thank you, Maha. I'll pass it on.
Thank you so much, Dr. Noor. Can you please stick to us for a few minutes? We would like to have a few questions, but I would love to thank you first for the wonderful presentation. Your voice was very calming, and I hope people found mindfulness or the 3 minutes helpful. Did we cover the applications?
Yes, we
did. All right. So
again, those are the applications. I very much encourage people to use them. If you do not want to download something, you can also find some websites one of the websites, sorry, I didn't write it here, but if you would like to write it for yourself, just, you know, though they are free, there is a mindfulness website called www.freemindfulness, okay, freemindfulness.org. And if you go to resources and then audio, you will find a lot of audio recordings to download, including 3 minutes breathing exercise. Start with something
Wonderful.
very small and short, and then you can take it from there. Okay, thank you, Maha.
Wonderful. We have a question for you. As a leader of frontliners, how can I manage, motivate, and support my staff?
That's an excellent question. Really excellent question. And it's a very good question. Bless you for thinking about your staff. I really admire compassionate leaders, honestly, who think not only about the quality of work, but also about those people who are behind what is considered as good practice. Caring, I always say, we cannot pour from an empty glass. So if you do not look after yourself and your staff, it won't be easy to really to be there for our patients. There are different ways of looking after our staff. And I'm very sure there will be more webinars talking about more details. You know, just, you know, connecting to what we're talking about today, I've seen it practiced during my training that some teams do start their morning or their meeting with 3 minutes breathing exercise. Okay, and then it depends on the hospital. I do believe, you know, I'm aware of King Faisal Hospital. I'm very sure in other hospitals there are some programs to support. Okay, so if you look for resources, I'm very sure you will find. And if you don't, I'm very sure Dime will be there to help. If there is any specific question, anything we can offer from my side, I'll be very happy to answer any specific questions if you are looking for anything specific for your staff. But thank you, honestly, for being kind and for looking after yourself.
Thank you, Dr. Noor. We have another question. Sometimes I feel afraid from getting the infection on attempt examining patients, and he's keeping his fear suppressed or repressed. What can he do to get rid of this fear? And I think this is a very common fear, especially this period, with a lot of healthcare workers being anxious about getting the infection. What can we give as a help for this answer?
Well, my dear colleague,
Question.
yes, my dear colleague, do not suffer alone. Okay, it's very normal to feel anxious. We do all feel anxious during this quite unusual time. And if you are a liner, it's very normal for your threat system to be activated, okay? So perhaps, you know, think generally about your emotional well-being. Mindfulness is only one of them, but there are a lot of different tools. If you feel that your anxiety level, again, an anxiety is a normal human feeling, okay? But if you start to feel that it starts to affect your ability to your work or your personal life or your ability to sleep and to function in your daily life, then please do ask for help. That's why Dr. Saud started this presentation talking about Dime. We are here for you. If you need help, please do come and ask for it, okay? Because unless you ask for help, we cannot offer help. Okay,
Wonderful.
Please
Wonderful.
do not suffer alone. Okay, and you're not on your own. Believe me, a lot of people are feeling anxious. And again, anxiety is a normal human feeling. Okay, it's not there to be suppressed. It is there to be listened to.
Thank you so much, Dr. Noor. Someone is requesting for you to repeat showing or sharing the link or saying the link you've shared about meditation.
Yes, absolutely. So that is www.freemindfulness.org. Okay, .org.
Great. We'll take the last question and then we will have a question for Dr. Saud. Your question, Dr. Nada, is there a difference between yoga and mindfulness?
Excellent question. So, are there differences? So, they do share a lot of principles, okay? I do sometimes practice yoga, okay? So again, awareness of your body, connecting with here and now, your breathing. Okay, so they do share some of the principles. Okay, and I would say the root of both would be in meditation. Okay, so yes, they do share a lot of mechanisms and a lot of the main principles. And
Wonderful.
I do really encourage people to, practice yoga if it is available for them, and it is available online. And yeah.
Thank you so much, Dr. Noor.
Thank
Wonderful
you,
presentation. Really appreciate it.
Thank you.
We have a question for Dr. Saud. Thank you for the amazing talk. I really enjoyed it. It was helpful and touched the reality and spoke of what is going on with us. My question is, are you in Da'am providing psychiatric or psychologist services?
Yes, thank you. Actually, we are providing both. We have psychiatrists and also psychologists. It depends on the request. We have almost, as we said, more than 40 or 45 between senior psychiatrists, senior psychologists. Most of the psychologists are a master and doctoral level. And also we have many well-known psychiatrists in them. So it depends on the request. If some cases needs psychiatrist will refer to the psychiatrist, and some cases will, if need, psychologist will refer to the psychologist.
Thank you so much, Dr. Saud. We are ready for our next wonderful speaker. Ms. Yasmin Break will talk to us about relaxation. We would like to welcome her. You ready, Ms. Yasmin? Ms. Yasmin?
Yes, hi, thank you. Good evening, everybody, and I'm happy to be with you in this seminar, and thank you to Da'am for inviting me to be with our healthcare workers, especially in this stressful time for Corona frontliners. I'd like to invite you all to first, maybe let's get together and let's get grounded again. So I'd like you to close your eyes, or maybe half close them. Let's do a couple of minutes of sitting quietly. Close your eyes. Breathe deeply. In through the nose and out through the mouth. And our belly is soft and relaxed. Relaxing with each exhalation. Every out breath, relax a little bit more. Perhaps saying soft as you breathe in and belly as you breathe out. Focusing on the breath and the words and on the feelings of relaxation in your belly. Feeling your whole body relax. If thoughts come, let them come, let them go, and gently bring your mind back to soft belly. Thoughts come and go. Focus on your breath. In, soft, out, belly. Okay, and open your eyes. Let your attention come back into the room. This is called a soft belly meditation, and it took 3 minutes. And I just wanted to start with that to demonstrate that attitude about relaxation. A little thing can make a big difference. So if you can put slide number 2. So relaxation, guys, is a physiological response that is innate and natural to our body. It's natural to all of us. And it is the opposite of the fight and flight response. Relaxation is best demonstrated by the state in which babies are born. If you have a normal, healthy baby and you look at this baby, babies are usually relaxed. They have relaxed muscles. They have strong and regular heartbeat. They have regular and calm breathing. This is what sometimes is referred to as remembered wellness. Because often we forget that this is our natural state of being. Maha, can you please put slide 2? So one of the most important differences between the fight and flight response and the relaxation response is that the fight and flight response is automatic. It happens within 3 seconds of perceiving a threat, and it does not require any interference from you. The relaxation response, however, requires intention. And usually, especially in the beginning, it requires at least 20 minutes of your time to elicit or to activate. The more regularly you practice, the less time it will require. And in that sense, it is also different from the mindfulness that Dr. Noor just described. It is a different technique and it has a different purpose. When you practice mindfulness as a relaxation technique, it is called meditation, because meditation requires longer time to settle in, and it has a different technique than mindfulness. And I intentionally wanted to start with this topic because relaxation is often confused by professionals and laymen alike. It is not relaxation technique. Relaxation is an innate response in everyone's body, and we use different techniques to elicit the relaxation response. Now, in modern hectic times, we're often in some stage of fight and flight mode. And naturally, more so in these times of COVID-19 for healthcare workers. Every healthcare worker, especially the frontliners, are currently in some kind of fight and flight. It is a threat. We have fear of being infected. We have fear of not wearing our PPEs right. So people are naturally more alert and more aware of this danger. And most of us rarely give ourselves the gift of relaxation. So our default, usually in modern times, is the fight and flight response. And in these times, especially these times of COVID-19, we have to encourage ourselves and others around us to take a 20 minutes window each day to practice relaxation and help ourselves connect with our remembered wellness. And Maha, if you can put slide 3. To do this, we have to practice some kind of relaxation technique. Some of these relaxation techniques are formal, like the one that I'm showing in this slide. I call them mind-body skills to differentiate them from relaxation and make a difference, distinguish them and give them a special entity. So the mind and body skills that are very formal, that most people use, are breathing, autogenic training, biofeedback, movement and exercise, meditation, and imagery. Some are less formal, like drawing and journaling, genograms, and rituals. The relaxation technique that you decide to use is a very personal choice. Professionals may recommend one, so I may tell you, do some breathing, or practice autogenic training, or do exercise, or do meditation, or do imagery. And you can try all of these, and you're recommended to try all of these. But the one that is going to be suitable for you and be a good fit for you, and you're going to like, and that is going to help you relax, is something that only you can determine by practicing. So there's not one technique that suits everybody. This is important to know because people often feel discouraged, frustrated, or even get angry with themselves or with the professionals because they could not master the technique. This is not necessary. Just practice different techniques and you will discover with time what works for you. Also, there are many people that are practicing relaxation techniques without calling them that. We have all done things like scribbling, doodling, baking, gardening, writing, or taking care of a pet. Our parents, our grandparents, our ancestors have practiced relaxations without calling them relaxation techniques, but they knew and understood the effect. Just recently, I had a client who told me that she received news that her dad had passed away, and her dad was in another town. Receiving this news, which of course I don't, but she said, you might judge me. And what I did is I went into my kitchen and I started baking cupcakes and decorating cupcakes. And within this 1 hour, I'm assuming that I'm not a baker, as you see, I think it took her about 1 hour. I think she said that this helped her collect herself, helped her get grounded again, know what she put herself in a state of mind of knowing, being calm enough what to do next. She got out of this baking thing, which is kind of a meditation exercise, that she did naturally, instinctively. And her dad was still dead. She still had to take care of everything, but she was in a better state of mind and body to do this. So people often say, relaxation doesn't take away your problems. No, it doesn't. And it's not intended to. It's intended to help you center, get grounded, release the tension of your body, and help your mind become more focused and grounded.
Miss
And I
Yasmin?
always advise my clients and patients,
Miss
don't
Yasmin, can you please try not
source
to
of
move the
stress in your
headset
life.
because it's
Whatever
disconnecting?
works for you is good. If it makes you feel relaxed, if it's baking, gardening, breathing, biofeedback,
Miss
meditation,
Yasmin?
imagery, if it works for you, if you feel relaxed, if you become again like that little baby that was just born, then you're fine. Okay, now I want to move to the topic of this
Miss Yasmin, can you hear me?
presentation, which is, of all these techniques, I chose to focus on imagery because I'm often approached on relaxation because of my relaxation, what people call my relaxation training recordings that are available on YouTube. They're available on Google for free. They're going to send you out the link afterwards. But
Miss Yasmin,
if
break.
I could put slide 4.
Miss Yasmin, can you hear me?
So of the many different relaxation techniques that we mentioned, we're going to focus on imagery. Imagery is the intentional use of your brain's ability to communicate with the body in images, in pictures. People come to me in my clinic sometimes and they say, I have no imagination. And my answer is that, yes, you do. You wouldn't be in my clinic if you didn't have imagination. People are imagining, or more accurately, this is the more scientific term, visualize, all the time. Mothers, fathers, wives, husbands, employees, they are using their imagination all the time. The problem is that they're usually using it to imagine the worst possible outcome. And I'm just going to have to hold this for a moment. Okay, sorry about that. So what I was saying is that people think that they can't imagine. And what I say to you is that you're always imagining. If you weren't imagining, you wouldn't honestly be in our clinics. The reason people come to our clinics because mothers, fathers, wives, husbands, employees are using their imagination all the time. The problem is they usually use it to imagine the worst possible outcome in the future, or they use it to retrieve sad or stressful memories from the past. And not only that, they're unaware that they're doing this, and their imagination is running wild and uncontrolled. It's like their imagination has a mind of its own. So these spontaneous images or visualizations can happen in the form of pictures. People sometimes see images in their head, sometimes sounds, sometimes people have smells in their heads, sensations like temperatures or textures, or they just have feelings. So at this point, the reason this matters is I'm going to lead into this with this little exercise. I'd like you to close your eyes briefly this time and just imagine walking into this beautiful kitchen that has these big windows with beautiful windows looking out on a garden. And in the middle of this kitchen is a counter. And on this counter is a lemon, a bright yellow, firm lemon. You walk to this lemon, you touch it with your hand, pick it up, touch it with your hand, squeeze it a little bit, feel how firm it is, feel how juicy it is inside, how fresh it is. Put it down on the counter and cut it in half with a knife. Now pick up one half, look at it, see the watery juice glistening in the light. Squeeze it a little bit and see that juice coming out. And slowly raise your hand and put 2 drops on your tongue. Just feel these 2 drops on your tongue. So usually in an interactive session, I would ask people what they felt, and most people will tell me that they had goosebumps, or that they enjoyed the taste, or that they felt the sourness of the taste, or that they just shriveled. Our bodies do not know the difference between real pictures and imagined pictures. So every time you imagine a fearful or sad or happy event, your body responds accordingly. Guided imagery, like in the recordings or in the apps, is the intentional use of your imagination to produce pleasant experiences. You actually do not need these recordings or these apps to achieve them. With continued practice, you can call on your mind to produce positive images that suit you, your personality, and your needs. But initially, most people need to use some kind of app that gives you a directed or guided imagery or visualization to produce some kind of effect. Now, the guided imagery tapes that I have, for example, on my account, can be used to achieve different effects. There are feeling state imagery, and this is guided imagery exercises that are designed to make you feel loved, cared for, safe, grateful, calm, or peaceful. Then there is end state imagery, and these are imagery exercises designed to help you achieve your goals, like presenting successfully, being on time, studying well, controlling your anger, or having a healthy lifestyle, like exercising more. And then there is biologically correct imagery. And these imageries help you connect with the biological processes in your body to overcome an illness. These are widely used in pain management clinics and in specialized centers like cancer centers. And these are specifically usually designed by physicians or nurses or pathologists, people who understand the process of an illness. Then there are metaphoric images, and these are guided imagery that use psychological concepts like the inner child or archetypes that symbolize courage, strength, and wisdom. And then there is spiritual imagery, imagery that evokes inner peace, wisdom, and a feeling of connection to a higher power in the universe. My recordings include all these 3 types, and in groups, like today, but usually live, I use the same words. I share the same words with the group members of the group. Let's say there are 10 or 12 people present.
Yasmin, we have 10 minutes left.
When we share at the end of the imagery, I ask people to tell me what they saw. Usually, although I said the same words, people will give me different images that came up for them. People were in different places, in different seasons, in different times. And so when you give it the opportunity, the time, and you listen, your mind and body will give you what your mind needs, the images that you need. So I'm going now to move to a special exercise. This is also available on my tapes. However, since I'm here, I thought I may as well give you a special in-session training. So I'd like you now again to, this is called the safe place imagery. And it's very useful to, it's a very basic imagery exercise, and it's very useful to use anytime, especially now for people who are dealing with COVID-19. It doesn't take too long. It's about 10 to 15 minutes, more 15 minutes. And let's just do it together. So I would like you now to close your eyes or you can just lower your gaze if it's uncomfortable for you to close your eyes. But I prefer people to close their eyes if possible, because that eliminates all outside distraction and it helps you to focus inward. But some people have difficulty with that. They have previous difficult experiences with closing their eyes. So just lower your gaze then, whatever feels good to you. And take a deep breath and allow yourself, give yourself permission to relax. Tell yourself, there is no place I have to be at this moment. No problem I need to solve at this moment. Nothing that I need to do at this moment. So it is okay for me to just relax. Allow yourself to go to a place that feels comfortable and safe to you. Perhaps a place in nature that you particularly love. Could be a real place that you've been to before, or an imaginary place that you have seen in magazines or read about in book. Could be a place indoors or outdoors. Just allow yourself to go to a place that feels good to you, that feels safe and relaxing. If more than one place is coming to your mind, just allow yourself to choose one of them. Allow yourself to come to rest in one place. Look around you now. What do you see in your special place? What sounds are there? What smells? What's the temperature like in your special place? Is it hot? Is it cold? Or does it feel just right? How do you feel in this special place? What are you wearing? Look at your feet now. How old are you? Make yourself comfortable wherever you are. Are you alone? Or is someone else there? A friend? A family member? Perhaps an animal? Make this special place perfect for yourself. You may like to add something or take something away from this place. If you would like to add something or bring something else into this place, please do it now. This is your own special place, your safe and comfortable place. Breathe deeply and enjoy the feelings of relaxation and comfort. And know that you can return to this place anytime you wish to relax and be replenished. Now take a few moments and just enjoy this special place. Now, knowing that you can return whenever you like, slowly and gently allow yourself to come back to the room that you're in and become aware of yourself, sitting or lying down, breathing deeply, connected to the space in that room. And when you're ready, and only when you are ready, slowly and gently open your eyes. And that's it. I don't talk after an imagery. I hope you enjoyed that place that you went to. Think about what that place meant to you, and know that you can always return to that place or to any other place just by giving yourself 20 minutes. Thank you all.
Thank you so much, Ms. Yasmin Break, for this wonderful new presentation. We have a couple of minutes left, so we will try to choose a couple of questions. We will start with Dr. Saud Al-Amar. About Da'am, are you offering in-person sessions or online, or do you do or by phone?
Yeah, actually, for the sessions, usually we offer by the phone during this corona pandemics, or sometimes through some online communication like Zoom, but mostly it is over the phone. Yeah, so all our sessions, unless like the practitioner preferred to have like Zoom, so it's like agreement between the counselor and the healthcare provider or the applicant who asked for the service.
Thank you so much, Dr. Saud. We have a question for Ms. Yasmin. As a frontliner,
sorry, ma, there is another question. I read another question. One of the participants, he said, I noticed that my colleague feels depressed and distressed. Can I apply for instead of him? Actually, it's difficult. He has to apply him or herself using her Mumaris number. But if you can like convince him, either you or anyone who used the service and found like a good impact and outcome, they might be able to convince him or her. Sorry, another maybe a question that they have read, last one. They said, do you have like some educational materials or pamphlet in English? Yes, the website that I have access at the beginning of this webinar There is maybe the last, there is two icon, evaluate yourself and read more about your mental health. Both there are some pamphlet and brochures, flyers about mental health and also about the service, how to apply for it. Thank you.
Thank you, Dr. Saud. If people want to listen to this webinar again, how can they reach it?
Actually, there is in the website, there is icon for all webinars which has been done and recorded. So this, if you can see at the left up corner of this screen, it is recording. So this webinar is recorded, but I think it will be available usually within like a week. So it will be available on the website. They can access it like within 5 to 7 days.
Thank you so much, Dr. Saud. We have a few practitioners asking if they can hear the recording again. And as Dr. Saud, it will be available. We have our next question to Ms. Yasmin. As a frontliner, how can we share mindfulness and relaxation techniques with our patients experiencing COVID-19? And how can I deal with this as a patient experience?
Thank you for the question, and it's a good question. So I'm going to say that sharing, now mindfulness is actually Dr. Noor's area, but if you want to share the relaxation techniques, if that's what you mean, or the imagery techniques that we, okay, if you want to share the imagery, the relaxation and imagery techniques, it depends a lot on the patient's status. So obviously, you're not going to be using this with somebody who has who's on respirator, I think, or who's in critical condition. However, if it's a milder case and the patient is able to interact and to work and with this, share with them the basic exercises, like the breathing. You know, there's several ones, so share the breathing, share the special place, share the inner guide meditation, and share the ideal self meditation. These are the ones, or visualizations. These are the ones that I would share with a patient who is battling COVID-19. You can also share the autogenic relaxation, and there is one called relaxation place, and there is one called place of bliss. So I can send them all to you. I'll write them somewhere, and you know, the DAM can share them with you again.
Thank you so much, Ms. Yasmin.
Thank
You for the wonderful speeches, and thanks from the bottom of our hearts, on behalf of Saudi Commissions for Health Specialties. Thanks for all you do. Reach out for help. It's normal to go through difficulties and struggles during this pandemic. We're here to help you. You're just a phone call away or a click on the website. Thank you so much for your time, and we'll see you next time, inshallah. Have a good night.